So you were a gymnast, right?
I did gymnastics for 15 years. And I have metal rods in my knees. I've had 4 knee surgeries.
So what happened? Like, when did you have your first accident?
I never had any accident besides falling off the beam or, a little accident breaking my foot or my wrist. I never had a specific accident. What happened was my outer muscles got stronger than my inner muscles. So it was pulling my kneecaps to the side and tilting them. And because your kneecap and your tibia bone are connected, my tibia bones are getting pulled to the side too. So they had to go in and cut my bone with a medical saw and move my bone and my kneecap over. I have rods and screws keeping them in place.
So is that like normal for gymnasts to have that type of repetitive type of?
Absolutely. It's this kind of knee surgery that I've had. You mainly occurs in gymnasts.
Yeah.
Yeah.
That's crazy.
Yeah, I don't know what it is exactly that our outer muscles are getting. I mean, all the conditioning that we do, our outer muscles get stronger than our inner muscles.
So how old were you when you started doing gymnastics?
3.
Wow.
Yeah.
And
I loved it.
And so, I mean, that's heavy where you're from, though.
In Romania, yes. Yeah. Romanians are known for gymnastics. They're known. I feel like my legs don't even touch the ground.
How tall are you?
5'1".
Yeah.
On a good day.
So, all right. So when I saw you, I like knew it was something about you. I didn't know what it was, but I was like, this girl's got a story.
Yeah.
And I mean, you see cute girls all the time, but there was something different about you. So like, I knew that right away.
Really?
Yeah, I did. I don't know why. I didn't know what it was, but I knew there was something.
Yeah.
To it.
Yeah.
So after your surgery, like, what happened after that?
Okay, so that's actually plays a big role in how I became addicted to drugs. My first knee surgery, I mean, I remember becoming an addict. I remember laying on my bed. I was 14 years old, okay? I was 15 when I had my first one. I had just turned 15. And I was laying on my bed, and I was already messed up when I woke up from the surgery. I was fucked up. Excuse my language.
Right.
But I woke up and felt great, and then, my dad had already had my prescriptions filled, and I went home, and my dad was like, "Here, go ahead and take these." And
so what was it?
It was called hydrocodone.
Okay.
Also known as Loratabs in the street, or Vicodin.
Right.
Vicodin.
And this was what year was this?
This was 2003, I want to say.
Okay.
2003. And my dad was like, "Here's your bottle, go ahead and take another one," because the doctor said to take one as soon as you get home. So I took 2. I remember. I was like, I just had surgery, I'm going to take 2. Mm-hmm. And my dad gave me the whole bottle because he didn't know, and I was laying there and I felt great. I remember I loved it, I was like, I want to feel like this forever.
I mean, you had to be in crazy pain from the surgery.
Yeah, well, I couldn't feel myself, I was numb.
Before you took the medication, though. Or you were numb even?
Before my knee surgeries? Oh, I was in a lot of pain.
Yeah.
I remember there was a lot of things I could not do. Like, I did cheerleading, too. I started cheerleading that year. So I was doing cheerleading and gymnastics. And, I couldn't run with the rest of the cheerleading squad. I couldn't, tumble. Like, I would only tumble during our cheerleading events. Like, there's a lot of things I couldn't do because the floor was harder. Cheerleading than gymnastics. And I was in a lot of pain. So, I was excited for the surgery. Because I wanted to, see if it would fix me.
Yeah, and they thought it was going to be, it was going to be good. You're going to be fixed after that. No more pain. That's what they thought, right?
That's what they tell you.
Okay.
They tell you that, they don't tell you you're going to be 100% better, but they're going to tell you you're going to be a lot better. And I'm sure you can get a lot better, but I never knew. Once that first knee surgery hit and I got on those drugs, I stayed on the drugs. And I kept on doing gymnastics and I kept on cheerleading, but I was numb most of the time,
Self-medicated.
Yeah, I was self-medicated. And nobody knew for the longest time except my best friend. Most people didn't know. So
once the initial prescription ran out, like, how did you continue to get prescriptions? Or
I
was
was
off the street at that point?
I hadn't started getting them off the street until my 3rd knee surgery. So my first 2, because I had 4 back to back, so I had them 4 months apart.
Oh wow!
So I kept getting them from the doctor, because I was either complaining or I would come up with some excuse. Or I remember even after my second knee surgery, I called the doctor and told him that someone had stole them. Yes, I started right away. And actually, I wanted to tell you this on my first day, and I was laying on my bed. My best friend was with me, and I was like, "Here, take one. Like, you're gonna love them." Like, I was just like, And so we were both laying on the bed. We're like, "Oh wow, this is amazing."
And you're 15 at the
I was
time?
15. I remember. I became an addict that day.
What about so was it a hassle getting stuff from your doctor, or was he just kind of like?
It was a hassle for a little bit because they don't want to give you as many.
Right.
They don't want to. You're young, but you're complaining that you're in pain, and you're complaining that.
And pain's one of those things. It's kind of hard to assess whether or not you're truly in pain or if you're just.
Absolutely, and especially being a gymnast.
Yeah.
And being in the sports world, they don't think that at 15 that you're sitting there an addict. You don't understand? So,
yeah.
But I started getting on the streets. After my second knee surgery, it went up to Percocets, and my third surgery, it went up to Roxy's, which is each pill is stronger in a dose. And then after that, I started going on the streets looking for them because you have to start maintaining. When you're doing opiates, opiate is a drug where you have to maintain it. You can't just take it here and there and be okay. Like, you have to continuously take it, otherwise your body physically gets sick and it needs it. So you have to start maintaining it, and you wake up, you're like, oh, I can't do anything. I can't get out of bed unless I have this drug.
Wow.
I can't take a shower unless I have this drug. So you're not only mentally, but you're physically craving it and needing it. So I started, slowly moving up the scale, and then started.
Now, at this time, did your parents suspect anything, or anyone in your family?
No. I guess, because I was on them for so long, I guess it became a normal thing for me. I remember actually my dad, one time when I was not high, and I was acting like real silly, because it's a downer, so it kind of calms you down and mellows you out. He was like, "Why are you high, Roxanne? Like, what drugs are you on?" And like, I was like, "Actually, I'm not high." Like, I was thinking in my head, like, "Actually, I'm sober." Like,
wow.
Yeah, so it became like a norm for me.
And how old were you when this happened? When your dad?
I was like 16 or 17.
So it was a pretty quick progression for you.
It was pretty quick, yeah. Like, when I started taking them from the surgery for my first knee surgery, it wasn't like I had to take like 3 at one time. Like, sometimes I would, just to be like, F it, like, I feel great, let me take 3. But I didn't have to at that point. But after about 9 months, a year later, after about my second knee surgery, I started having to take more to get that feeling. And so it was a pretty quick progression.
Now, like, we talked, and I said, I grew up in what a lot of people would consider the hood. I wouldn't consider it the hood. A lot of people would.
Right.
And I wouldn't know where to go find heroin right now. Like, there's a lot of drugs that I could probably find if I wanted to.
Right.
But so how did the progression from the pills to the needles?
Okay, from the pills to the needles, and that's funny because I remember when I was on the pills and I knew I was addicted. I didn't want to believe it. I didn't want to think I had a problem, but deep down I knew it. But I thought that I could overcome it if I wanted to. I just didn't want to. I didn't want to stop. But I would be like, oh, I will never go to the needle. Like, that's just a whole nother level. That's junkie status, capital J junkie status. Like, I won't ever get there. And what happened was I got so bad off the pills where I quit swallowing them. I started snorting them. I got to the Roxy's, and then I got to the Oxys. Roxy's and Oxys you can break up into powder and snort them. Some people would even shoot them, but I hadn't gotten to that point yet. So I was snorting them, and I got so bad on the Oxycontins, so bad to the point where an Oxycontin 80 goes for about $60 a pill on the street.
$60 a pill?
A pill on the street. And now this pill, depending on your tolerance and how much you can take, can last you a full day. It can, for me, it got to the point where the night before I would go to sleep, I would crush up 2 80s. That's $120. I'd crush up 2, and leave them on my snorting station. In my closet, I had a dresser. I called it my snorting station. Yes.
Unbelievable.
And so I would break them up before I go to sleep. So when I wake up in the morning, the first thing I would do is I would snort one up one nostril, one up the other nostril to get my day going. That's how I got my day going.
So how would you feel like, there were obviously days where you didn't have it. What were those days like when you couldn't wake up and?
Oh, I was miserable. I hated life. You didn't want to come across me. I was so sick. I mean, I have stomach conditions. I have colitis in my stomach and gastritis and ulcers, and I have a lot of problems. And so I get more sick than most people who do this drug. And so I would be so sick, and so I'd be on a hunt. I mean, my day would wake up if I didn't have it, or the night before. That's why I started the night before. I started my hunt the night before to ensure that the next day my day would get by. And at this point when I was on the Oxycontin, my dad still had a lot of money, and he was still supplying me, not knowingly. He had no clue that I was using his money to get drugs. And at the same time, I was working too, so I got to keep my money, and my dad was giving me money, and I had plenty of money, And of course, if my dad knew that would have never happened. But so the only way that I wouldn't have anything is if it was dry on the streets. And if it was dry on the streets, I would, word of mouth would go around like, hey, I got a script coming today, and I'm like, shit, let me take the whole script, run it. I'm gonna take all 60 of them. Like, yes. I would be that person, like, to come clean out the dope man from all his pills, because I would try to make sure, okay, I'm gonna be okay for all week. But it wouldn't last for how long I would try to make it last,
Yeah, because if you have more, you're gonna do more.
Absolutely. Right? So then that progression made it way worse, to where I would need even more to maintain myself and to make it to work. And
what's the most you spent in a week?
Oh, I would say back then when I was on the Oxycontins, when they were $60 a pill, I was spending a couple grand a week sometimes.
Wow.
A week. Yeah. And so after that, what happened was I got so bad, and I got so sick of being sick. I was sick and tired of being sick and tired. But this went on for years. But in 2010, I checked myself into the methadone clinic.
What was the last straw? What do you think?
Well, that still wasn't the last straw. But at that point, it was getting too expensive for me. I had gotten my boyfriend, who had become my fiance at the time, addicted to him as well. And when I got with my boyfriend, he was 6 years older than me. He never had done a drug in his life. And he went from doing no drugs to Oxycontin 80s. Like, that big step. I mean, Oxycontin 80s, they quit making them now. They quit making them to where you can crush them up, because so many people were dying off of them. But he became so codependent upon me. We became codependent upon each other. My dad had moved back to Romania at this point. My life started falling apart. I started losing a lot of weight. People quit talking to me. I started stealing. I started lying. I started manipulating. Anything I could to get the drugs. And so I was sick and tired of being sick and tired, but not sick and tired enough. I took myself to the methadone clinic. At the methadone clinic, I was there from January 2010 to December of 2010. I was there for the whole year, and not one time did I pass my drug test. You get drug tested every week. And the only reason they didn't kick me out of the methadone clinic is because I always paid. And people at methadone clinic get so behind on their bill because it's $12 a day.
That was my next question. Like, why did they keep you there?
Money. It's like legal heroin for the government. That's all methadone is. And now for some people it does work. I've seen it work for some people, but then you get addicted to the methadone, and methadone is the hardest drug to come off of.
Yeah, I'm not familiar with that. So
methadone, you go to the clinic every morning, and they dose you. There's a pharmacist, and the pharmacist doses you, and you start at a low dose, and they bring you up. But it's a way for the government to get you hooked onto that instead of street drugs. And so now you're paying the government, and the government's making money. It's absolutely horrible.
So now you're paying for something that can be taxed.
That can be taxed and can be controlled by the government, and it's worse. It's synthetic. It's man-made. And so that's how my progression to the needles occurred. Because when
From the methadone.
Because when I was trying to come off the methadone, before I went to the methadone clinic, I didn't do any research. I just was like, oh, like I heard about it. I'm like, oh, it's the next best thing. Like, let's get off the drugs. Like, let's try it. I tried, but it didn't work. So then I was doing methadone and the drugs. So then I tried coming off the methadone, but I was so sick, I couldn't keep anything down, nothing. And I was at my friend's house. My dad was in Romania. I had broken up with my fiance at this point. So it was December of 2010. I broke up with my fiance. We were together for 4.5 years, and I didn't have anywhere to go. My dad went through a hard time. He got sick with his heart, and he was going through a hard time. Keep in mind, at this point, some people have an idea about me. A lot of people still don't. Some people do. The people that I was lying to and stealing from and manipulating.
Who knew you were in a methadone clinic?
Very few people. So I thought. That's what I think. It's my whole life is a blur, so I can't really. Like now when I go talk to people, they're like, I'm so glad you're doing great. Like you look awesome. Like they can tell even from my Facebook post. Like I talked to this guy on Facebook the other day, and he told me, he said, you look so good. You're doing so awesome with your family and all your posts. And I'm like, I haven't seen you in like 6 years. Like where do I even know you from? Yes, wow. They could tell just from Facebook. So, but that was a progression too. The whole people being able to tell. I think, but I will never know because people don't just come up and talk to me about it.
Yeah.
But at this point, I don't believe many people knew. So opiate scale is everything from what started from the knee surgery, the hydrocodone, Percocets, the Roxys, the Oxys, methadone.
So you were basically from the time you were 15 years old at a point where you were pretty much unable to deal with real life. Like,
yeah.
You were in a daze most of the time.
Most of the time, yes.